So what's going on with this dark band of skin at the base of the neck or in the armpits or in the groins? It seems to get worse over time and it doesn't wash off. I can explain. My name is John Pilcher. I'm a bariatric surgeon in San Antonio, and I see this condition in a lot of my patients. The name of the condition is Acanthosis nigricans. And Acanthosis nigricans is not a lack of hygiene or a lack of washing, obviously. Acanthosis represents an underlying abnormality of a set of hormone imbalances, insulin resistance and diabetes, polycystic ovarian syndrome, and the obesity disease. And something about these diseases and the hormone abnormalities causes the body to secrete extra melanin in the areas that darken. Melanin is the natural pigment that causes a browning of the skin, and it's what leads to all the lovely shades of color that humans have across the globe. It's just that with this disease, acanthosis, there is abnormal or excess melanin secretion in certain body areas, kind of the folds of the skin. What's to be done about this condition? So the first thing to do is to look at the underlying conditions, especially the insulin resistance. And with any disease, the way to treat it begins with lifestyle intervention. And for insulin resistance and diabetes and the, obesity disease and acanthosis, lifestyle intervention begins with healthy food plan. And the healthy food plan typically is low carbohydrate and also low chemicals. We see that artificial sweeteners and preservatives become part of the metabolic imbalance problem. So low carbs and also increased exercise can help with insulin resistance and can help with this overall condition. Unfortunately, by the time acanthosis shows up, most often it doesn't correct fully with just lifestyle interventions, although those will continue to be a foundation throughout the treatment plan. The next step after we've done all that we can do with lifestyle intervention is to think about medicines. And until recently, medicines were not very successful for treating acanthosis and kind of not successful with some of these other conditions. But there's been a new generation of medicines recently available. Examples of these medicines are Ozempic and Wegovy and Mounjaro. And these medicines began life as treatments for diabetes, but they also help the obesity disease and they help insulin resistance, and thus they also can help acanthosis to a significant degree. Even so, the medicines are often not powerful enough to bring acanthosis or the associated conditions fully under control, and that's where bariatric surgery may come in. And so operations like a sleeve gastrectomy or gastric bypass can be very successful in treating the obesity disease and the acanthosis and the underlying insulin resistance. So I hope this information has been helpful for you.